Hello, Dr. Welgan again. Thank you very much for joining me in this segment of my presentation series on gastrointestinal disorders. For those of you who are joining me today, welcome aboard. We are in the middle of a series of lectures, actually, on subjects that interest me as a clinical psychologist, research psychologist, and psychophysiologist. For those of you who are joining us for the first time, as I have mentioned before in my lectures, if you'd like to catch up on where we are, go to my website, the Welgan Center for Behavioral Medicine, and you'll notice that there is a calendar of archived video lectures that I have conducted for all of you, the general public. And if you're interested in any one of them that you'd like to review, go ahead and click on any of them, okay? But currently we're in the middle of a series on gastrointestinal disorders. We have covered irritable bowel syndrome, and we've moved on to the inflammatory conditions of the gastrointestinal tract, and in particular, ulcerative colitis and Crohn's disease. As you know, we've completed a brief description of ulcerative colitis just earlier in my lecture. And now we're moving on to another inflammatory bowel disease called Crohn's disease. Now, Crohn's disease, for those of you who've been tracking me here, is similar to colitis in some important ways and differs considerably in others. First of all, we're looking at a condition here of the entire gastrointestinal tract and beyond that is an inflammatory condition. That is, inflammation is at the center of this reaction in the gut. In ulcerative colitis, the effect of this inflammation over a period of time begins to affect the rectum and the colon and the epithelial level of tissue in the gastrointestinal tract. Epithelium, top layer. It erodes the top layer. But in Crohn's disease, it seems to be much more malicious and insidious. The destruction of the tissue in the gastrointestinal tract passes beyond the epithelium into the entire wall of the gastrointestinal tract. By the way, it's not restricted to the colon or rectum. As I mentioned a moment ago, evidence of the disease can be found throughout the entire gastrointestinal tract and also outside of the gastrointestinal tract. You'll see it as aspects of arthritis, some liver problems that can result from this, even certain eye conditions can be a manifestation of Crohn's disease. It's really kind of a nasty condition. Inflammation is at the heart of both Crohn's and ulcerative colitis. In ulcerative colitis, one of the ways that ultimately we try to arrest the condition is by removing the entire colon, okay, and just bringing down the intestinal tract and connecting it to part of the rectum. That can work for a while for some people. Sometimes the ulcerative condition resurfaces at the site of the incision, and there are all kinds of possible complications down the line following surgery. But more importantly here, if you want to get rid of that condition, just remove the colon. You can't do that with Crohn's disease, unfortunately. There's no way of just removing the colon. It actually spreads throughout the GI tract, right up the soft palate. By the way, in both conditions, there's really no cure, and particularly Crohn's disease. It's really a very demoralizing condition to have. For those of you who have it, you are working with a gastroenterologist, I'm sure, okay? And your physician is attempting to create a menu of medications here that will mitigate the inflammatory response and also the effect and the damage that inflammation creates. Now, as a former member of the faculty over here at UCI, I'm very much aware of the special program that UCI has for those of you who have inflammatory bowel disease. For those of you who haven't, you're probably aware of UCI's program for the treatment and support of patients who have these two conditions. It's really a wonderful program. The gastroenterologists over there are really quite good. But once again, the conditions themselves are not curable, okay? So we're managing symptoms to a large extent, unless I get a call from one of my friends over there on campus saying, look, we got a cure here. Okay, I'm waiting for that call. In the meantime, the reason I'm interested in this as a psychophysiologist, remember what I mentioned before, I'm interested in the extent to which psychological factors actually affect, either cause or inflame psychological or physiological conditions, okay? My interest in now an inflammatory bowel disease, these two, is with inflammation, which is the chief culprit of these conditions. There are other factors that interplay with to create an inflammatory climate, but inflammation really is a product of your body's defense system looking at you, your colon, your gastrointestinal tract, as if it were the enemy. So we get a reaction from the thymus gland and other parts of the immune system as if it were looking at a disease process, an enemy, and attacking it and trying to destroy it. And one of the ways that the defense system actually works is by producing inflammation, okay? So inflammation is good. When you have some real need to kill viruses and bacteria, but when you want to produce an inflammatory reaction that actually kills your colon and your gastrointestinal tract and maybe you, there's something wrong. It is what's called an autoimmune disease, and it's only one autoimmune disease that you may well be familiar with, okay? But both conditions, particularly Crohn's, is a really nasty one, and it is very difficult to manage. So, what am I doing in gastroenterology here and inflammatory bowel disease territory? Well, as I mentioned to you, my last lecture, I'm interested as an experimental psychologist and a learning theorist on how we can actually impact the inflammatory process. The inflammatory process, not stressors that can aggravate the condition, perhaps psychologically anyway, like depression and anxiety and uh, ongoing stress, which, by the way, are factors that can complicate those conditions, and for which your gastroenterologist may actually want you to actually see one of us to treat those conditions to reduce the impact, the risk factor coming from them on the gastrointestinal tract. I'm interested in something else. I'm interested in that as a clinician, but I'm interested in actually modifying, changing the inflammatory reaction of your own body. And that's my area of research right now. And it's with that in mind that I'm bringing this up today, because I am interested in the middle of it right now, creating clinical trials to test my procedures, their effectiveness on actually, over time, impacting and affecting and modifying your own inflammatory reaction in your gastrointestinal tract. Sounds kind of strange, huh? But that's what I do. I'm really interested in how you can actually impact a particular organ system's function. I'm a psychophysiologist, and I'm a learning theorist. May not know what that means completely, but I'm really interested in trying to help you achieve control over that function of the body. Now, if you're interested, by the way, as an IBD patient, you're welcome to call me and leave your name and telephone number as a possible candidate for the enrollment of these studies, okay? By the way, you'll notice on my website that there's an information form that allows you to identify yourself as somebody interested in one of several of my clinical studies. If you're interested in that as a patient with Crohn's disease or one with ulcerative colitis, just click on either one of those categories and email it to me, okay? With little information on yourself, your telephone number, your email address. And I'll be glad to get back to you. We have orientation meetings for those who are coming in and wanting to learn more about the studies. Those orientation meetings are free here, and I provide a much more detailed explanation of the nature of the studies, okay? And length of time, etc. You'll have a lot of information about that when you click on my site. By the way, I want to get back to you before I conclude this discussion on Crohn's disease. Remember the last time when I was talking about ulcerative colitis, there are several features of ulcerative colitis that Crohn's disease shares. And I listed a few of them over here. Real quickly, I'd like to review them with you. It is a process I told you earlier of the colon and the rectum. It also affects the entire GI tract beyond. It's an autoimmune disease. It affects the mucosa, like ulcerative colitis. Also the entire GI tract. Penetrates the walls. It's a process, a product of inflammation, largely. That's the destructive process in the GI tract. Bleeding, rectal bleeding is common, okay? Like ulcerative colitis. Cramps, weight loss. And perhaps the most prominent feature outside of the gastrointestinal tract is anemia. There are several other features here. Crohn's disease, but this will get you started. For those of you who think you may have that condition, please consult your physician. And most of the time, for long-term care of the Crohn's disease, you probably want to see your gastroenterologist, okay? Not curable. So we manage it. And in this case, as a psychophysiologist, what I'm interested in helping you do is manage the inflammatory response. And how you do that, I'll have a lot to say in our orientation meetings. There are psychological factors that impinge on this that you can actually address. Remember, I'm interested in the psychological factors that contribute to a medical condition here. I'm not treating this medically. I'm treating this from the side door, okay, as a psychophysiologist. Okay, with that very short introduction to Crohn's disease, if you have an interest, I mentioned earlier, you can contact me. Once again, my email address is PETERRWELGANPH.D as in dog at cox.net. My phone here at the center in the office is 949-509-6576. Okay, for those of you who have some interest in this, those of you who are suffering from these conditions and are interested in learning more about my clinical trials programs, this is going to be through a branch of the center. This is my research foundation for the advancement of behavioral medicine. Thanks very much. We're going to be moving on next time to GERD, gastroesophageal reflux disease. Thanks very much.